Welcome to our podcast, Travel Unraveled, an ISTM podcast sponsored by the International Society of Travel Medicine.
The whistle blows, the crowd erupts, flags are flying, streets are packed, and millions of fans are crossing borders for the biggest sporting event on earth, the 2026 FIFA World Cup. I'm Aisha Khatib, the podcast director for the International Society of Travel Medicine, and this is Travel Unraveled, the ISTM podcast. This summer, the world turns its eyes to the biggest sporting event on the planet, the 2026 FIFA World Cup, spanning 3 countries, Canada, the United States, and Mexico, and drawing millions of fans from across borders. This isn't just football. It is one of the largest mass gatherings in modern history. And with it comes unique convergence of travel, public health, and infectious disease risks. But behind the goals, the goats, the gathering of diasporas and chants, and the late night celebrations, like I had last night at the Portugal game, another team is on the field. Travel medicine. So mass gatherings and events like the World Cup test both travelers, host cities, and health systems alike. So what should travelers know before they go? Today, we're diving into the fascinating world of mass gatherings medicine, where celebration meets surveillance, and where travel medicine plays a critical role in keeping the world moving safely. So lace up, the match is about to begin. Joining me today are Travel Unraveled hosts, Dr. Anne McCarthy and Dr. Albie DeFrey. On today's episode, we will be discussing what vaccines should you get before travel to a mass gathering such as a sporting event or a religious pilgrimage such as the Hajj. When should you begin preparing and what's the ideal timeline for preparation? We'll be talking about climate considerations, how to prepare for extreme heats or cold, and what considerations should you consider for crossing borders. Today, we have 2 perfect guests for this episode, and I'll pass it on to Anne and Albie to introduce them.
It's my distinct pleasure to welcome Dr. Jill Weatherhead, who's a U.S. soccer infectious disease consultant, director of pediatric travel medicine at Texas Children's Hospital, and adult tropical medicine clinic in Harris Health System in Houston, Texas. She was co-author of the recent 2026 FIFA Cup guidelines for travelers. Bill, while we've been preparing for this podcast, you've been in many different places. So where are you today and where have you been in the last few weeks? I gather you've been chasing after a football somewhere.
Yes, I'm always chasing after a football. I love the sport. I love all sports, but this World Cup is so exciting, and it's really gotten a hold of everybody around the world. So it's been a great couple of weeks. I am a diehard U.S. national team fan. I've spent some time in Mexico at some of the games there, and certainly in Houston, where I'm based. Currently in northern Michigan, so I'm close to you, but have really enjoyed the experience of all these nations coming together. It's been a real treat.
Fantastic. Albie?
Yeah, so good day from the other side of the world. I have the pleasure of introducing our other guest for today, Dr. Salim Parker. He's a travel medicine and general practitioner, travel health specialist and general practitioner based in Cape Town, which is, of course, on the other end of South Africa. I'm at the top end, he's at the other end. He's past president of the Southern African Society of Travel Medicine and part of the current executive of the society, and he serves on the liaison committee of the International Society of Travel Medicine. He co-authored the Hajj travel chapter in the last 4 editions of the CDC Yellow Book on Travelers' Health, and he's an honorary research associate in the Division of Infectious Diseases and HIV Medicine at the University of Cape Town, and he collaborates with the Global Center for Mass Gatherings Medicine based in Riyadh. He has accompanied pilgrimages on the annual Hajj to Saudi Arabia as a medical officer for more than 20 years, and is, you wouldn't say it, well, that's why he hasn't got any hair. He's been doing that for 20 years. And passionate about Sorry, Salim. I was going to say you don't look the age, but, I looked at the hair and I thought, I've got to say something.
I'm going to get my yellow card out here,
Like both of us have got Springbok jerseys on, and they don't do yellow cards in rugby, or do they? I'm not so sure. No, Salim, that was your formal introduction, but I just want to say that as Salim has been teaching mass gatherings and Hajj travel on our annual travel medicine course, and I believe that it is the best lecture in the world on Hajj travel. So it's a huge pleasure to have Salim with us today.
Thank you for that, Albie. Your check is in the post. Or do we get checks and
That's the way we work around here.
But just remember, South Africa, that's why both of us are wearing this particular jersey. We're still the Rugby World Champions, 2019 in Tokyo, and 2023 was in France. So, yeah, it's an absolute pleasure and honor to be here, and really good to be part of this discussion on mass gatherings, whether it's sports, religious, or any other type of mass gathering. It's always fun and interesting to be debating the issues around it.
So I think that's a really important point you bring up, Salim. We're talking about not just the FIFA World Cup, although, I mean, we're in the moment for it. And so we thought this was very topical, but we just finished the Hajj pilgrimage in Mecca, Saudi Arabia. Jill, you're working with the Women's World Cup coming up in Brazil next year. The next FIFA World Cup in 2030 is going to be a huge cross-continental World Cup being held in Spain, Morocco, Portugal, and even Paraguay and Uruguay, and talk about that Paraguay team. Oh my gosh. And then, in 2034 in Saudi Arabia. And of course, there are the other mass gatherings that happen around the world. And Salim, you can speak to these perfectly. The Hajj, the Umrah, the Arba'in, the Kumbh Mela. These are religious pilgrimages, that happen. And not to forget, summer music festivals and concerts like Coachella and Glastonbury. These are all considered mass gatherings. And so what we're talking about today will apply to all these events that are happening and will keep happening around the world as we bring together diasporas and countries and people from everywhere.
Having just returned from Europe, I have to add another ongoing series of mass gatherings. It's called the immigration procedures entering and exiting the Schengen countries. It is an absolute nightmare. It is a mini mass gathering on every time you cross the border. So be warned. And at least one kid will be snottering all over you. And there's one dear little old lady that passes you in the snaking queue every couple of minutes. And she's got this deep productive cough. So be warned.
Speaking of deep productive coughs, let's hand it over to the infectious disease doctor to talk about some infectious disease risks at these mass gatherings. So Jill, go ahead.
Yes, what a great segue. So we do, when we're thinking about these mass gathering events, we think about our more typical viruses and bacterial infections. So as travel doctors, as infectious disease physicians, we like to think, you're traveling to these other countries or you're going across borders, we need to be thinking about travel-related vaccines and infections. But really what we want to be talking about are just our common, straightforward viruses and bacteria that are going to be increased risks when you're in close contact with other people. So when I'm talking to my patients or I'm talking to my family and friends that are going to these events, I'm talking about respiratory viruses. I'm talking about influenza and RSV and COVID that we really need to be talking about, especially right now when you're thinking about, we're in the summer months here in North America. So Canada, US, Mexico, we're in the summer months. We don't need to be thinking about influenza and RSV and COVID, but we do because we're seeing cross hemispheric travel. So you have people coming in from the southern hemisphere where they're having outbreaks of influenza and COVID and RSV. And so making sure we're talking about those infections that we don't typically talk about seasonality because we're in our summer months is important. And so those respiratory viruses are critical to be considering right now, especially because we're so packed in and I'm not sure how much you guys know of Houston, but we're not known for our public transportation. There's one train line that goes to the stadium, and I'll tell you, my family and I took it to the Brazil game, and we were packed in there like sardines. And all I could think about was all those viruses getting spread around into this tiny little cabin. And so it's something you need to be thinking about when we're going to these mass gatherings, whatever the event is, when you're packed in, when you are in those close contacts, those respiratory viruses spread like wildfire.
That's very helpful. I guess, Salim, for you, in Mecca or in religious gatherings, there's other things that they worry about as well with respect to concern of respiratory spread. I'm thinking specifically of meningococcal vaccine, which has been, meningococcus has been spread from the Hajj and brought back to the different countries because people come from all countries, similar to what you said about influenza at different hemispheres, different times of the year, or in the tropics, it's all year. But what about meningococcal and other vaccines for the Hajj with respect to infectious diseases?
As far as the Hajj, for example, is concerned, that's the annual pilgrimage to Saudi Arabia. And just to add to Jill, about 90% of the participants during the Hajj will complain of one or other type of respiratory infection. So that is a known factor. And the reason for that is crowding again. Up to 8 people per square meter at the peak of the Hajj itself. So it's crowded over there. So meningococcal disease, there was an outbreak in 1987 during the Hajj period itself, but more importantly, it led to the worldwide export from Saudi Arabia. And there were wave after wave of epidemics in meningitis belt subsequent to that. So Saudi Arabia in 1988 introduced compulsory meningococcal vaccination against serogroup A. That's two different types, A and C, because that was the only vaccine available. But then in 2000 and 2001, a different strain of meningococcus emerged, which is W. It's called serogroup W. And since then, there's been, and after the two epidemics in 2000 and 2001, again, there was a worldwide exportation of the same group, the same type, to 14 different countries worldwide, from the United States in the west to Indonesia in the east. Saudi Arabia then made it compulsory that a 4-strain vaccine was necessary before you could get a visa. You couldn't enter Saudi Arabia without proof of this vaccination. And since 2002 till 2019, there wasn't a single case amongst travelers showing that vaccination and enforced policy is actually quite efficacious. However, since 2019, there's been different visa applications to Saudi Arabia, including one which is called a tourist visa, for which you don't need to show proof of a meningococcal vaccine. Now, firstly, this vaccine was cheaper. Firstly, this visa was cheaper. The tourist vaccine was significantly cheaper than a religious pilgrimage visa. Secondly, didn't need proof of the vaccination. So obviously, people started using this using this visa without taking the vaccine, and then still perform the pilgrimage where they still had these crowded conditions. So what happened? 2024, 2025, outbreaks amongst pilgrims, as well as in the countries that they returned to, there were outbreaks. For example, a country like Uzbekistan, the incidence of this outbreak of meningococcal disease was 10 times higher than the incidence in 2023, all amongst unvaccinated returning pilgrims or children and other adults who were in contact with them. So here again, the efficacy of vaccine has been shown to be very effective when it was enforced and when the rules were relaxed, where this resurgence of this particular meningococcal outbreaks, not only in Saudi Arabia, but also worldwide.
Thank you. All right. Do you want to, let's ask Jill another question. So if I'm going to a packed stadium in the US or Mexico, for example, where you were, what do you recommend for those travelers to try and keep them healthy while they're there?
Yeah, that's a great question. This is something that I think that's going to come up a lot in our discussion. Is preparation is key. So knowing where you're going, knowing what's going on in that region, and preparing beforehand is critical. A lot of us are, though, buying tickets last minute to random games in random areas. And so you can take other more acute precautions. For example, if you're sick, not going into these packed stadiums, one, for you to recover, but two, so that those infectious diseases are not spread. But making sure you're up to date on your routine vaccines too. This has been a critical point, especially here in the U.S., where we're seeing rising cases of vaccine preventable illnesses. You know, we have cases of pertussis. We certainly have had many, over 30 outbreaks of measles here in the United States in the past year. We've had over 2,000 cases in the first 6 months here in the United States, and it's a lot of this is because our herd immunity is decreasing, our vaccination rate is decreasing, and so staying up to date on those vaccines, staying home if you're sick, being aware of your surroundings in terms of infectious disease risks is going to be important. But those vaccines, I cannot stress them enough. Routine vaccines, staying home if you're sick, staying hydrated, and some of the more environmental precautions I think we'll get into here in a little bit. But vaccine, and stay home if you're not feeling well.
I think that's great advice, but once in a lifetime chance to see something like this. I'm sure people aren't going to be staying home. And, wearing a mask and trying to decrease the risk of spread is a great idea, but it's been very hot in a lot of these venues.
Yep.
And I'm not sure how much people are going to be able to keep a mask on, even if they want to. So I guess we all have to accept some risk, right? With respect
Absolutely.
to that.
Yeah. I mean, I think that's a huge piece, though, is just understanding the risk, being educated about it is an important piece to this. I never, want to tell people not to go do these fun things that are seriously making huge improvements in people's quality of life. People are just having the best time. We don't want to deter people from that enjoyment, but understanding risk is a great way to allow an individual to make a decision on what's best for them too.
Correct. All right, Albie, do you want to ask a question?
No, I think I just want to tie in. We get to give the answers, not to ask the questions. Now, so Salini was talking about the fact that meningococcal vaccination was compulsory for the Hajj or for pilgrims, and now it is no longer. Just a little aside thought is, have we seen similar outbreaks of meningococcal disease in other mass gatherings? Have we seen that after a previous World Cup, Soccer World Cup, etc.? Or is it just not as well documented as the Hajj? But the thing I really want to tie into is, so Jill has already pointed out the fact that we should really all be up to date with our childhood vaccines at any time in case we want to go somewhere exciting. In a rush, we don't have to worry about, are we up to date with diphtheria, pertussis, tetanus, etc. But then if you go to certain areas, then, compulsory used to be meningococcal disease. But the other one that's compulsory for certain areas is yellow fever vaccination. And that's in line with international health regulations. So now we get into the area, and Brazil springs to mind in terms of the World Cup, is for some people, everybody may potentially be at risk of contracting yellow fever because it's a day-biting mosquito-borne disease. But for some people, it's compulsory to have the vaccine because we're trying to prevent the importation of the virus from affected countries like Brazil, for example, back to South Africa. So you're coming back to South Africa, our Port Health people, if they're awake, are going to ask you for proof of yellow fever vaccination. But if you're going back to the UK, you go back to Canada, nobody's going to ask you for proof of vaccination. Yeah. So maybe, Jill, you want to touch on just a little bit of this conundrum, so to speak, of personal risk with a public health interest, because that's the ball we're playing with in travel health all the time.
Yeah, absolutely. I do want to answer the first part, there isn't a lot of data on meningococcal outbreaks after sporting events in the literature. There was a Geosentinel paper out after the FIFA World Cup in 2014 and the Summer Olympics in 2016 on infectious diseases from those big mass gathering sporting events. And really what they saw in those were dermatologic conditions, diarrheal conditions or syndromes, and febrile systemic illness, but did not document any meningococcal disease, whether that's just people were not connecting that back or we're not following it like we have been in other mass gatherings like pilgrimages.
I'll just comment, actually, there have been some concerts in Toronto, actually, where there have been meningococcal outbreaks. So they may not have been published, but we have seen that here through public health and these gatherings and these concerts.
Yeah, that's a great point. Salim, were you going to mention that too?
Yeah, firstly, Alvin, just a correction. The Saudis have clamped down on the meningococcal vaccine requirement since this year, so it's back in operation. And you're going to answer about the yellow fever risks.
Yeah, absolutely. So I think jumping to the second part of your comment, Albie, is yellow fever. And as you mentioned, coming back to the U.S., although we recommend travelers to get yellow fever vaccination, it is not required when we have somebody coming in to the U.S., despite having the vectors everywhere here, especially in the southern United States. I mean, we are primed to introduce other vector-borne illnesses, including yellow fever, into our vector populations here. And so it is a real conundrum, how do we prevent introduction of vector-borne illnesses into new communities where the vectors are present, in addition to how do we protect the individual or who are traveling to endemic areas. And it really is a interesting question and one that has led to a lot of variability in practice because each government is doing things a little bit differently.
Yeah, if I may add to that, I just came back from Uganda. I was there last week. I flew via Nairobi. So no one asked me on the outbound flight when I landed in Nairobi or in Entebbe for yellow fever vaccine, proof of vaccination. They were more worried about have you been in contact with anyone with Ebola. Similarly, on the way back, Nairobi and South Africa normally insist on proof of yellow fever vaccine on return from either Uganda or Kenya. But both, in fact, no one on the flight that we came back on was asked for yellow fever vaccine proof. I mean, I actually observed it. So it's not only the epidemiological surveillance and the medical parts, it's also the actual practical implementations and looking for the cards itself, when it's actually being implemented, that's of concern currently.
Salim, you make a good point there. I mean, I don't know if you had to quarantine for 21 days after being in Uganda, but the Congo team had to quarantine in Sweden before they came to the United States because of the Ebola outbreak. So I'm wondering if you guys can speak to that in regards to how that may impact travelers who are crossing borders, who may be coming into different countries that have different requirements for things like quarantine and visa entry rules. I mean, we're seeing kind of what's been happening with the visa discrepancies for different particular teams, and I'm not going to politically say which ones or who, but in regards to that, I think it's an important factor, especially when people are crossing so many borders. Could you speak to that?
Yes, I'm happy to speak, especially on the first part in regards to the Democratic Republic of the Congo's soccer team or football team. They were stationed or housed in Houston, and so we had a lot of discussion about this. In the United States, there were port entries where people from these regions could enter, and non-U.S. citizens did have to quarantine before coming into the United States. It's still the current recommendation for 21 days prior to entrance into the U.S. So as you mentioned, the DRC's national soccer team had to be out of the Congo. They missed a lot of their fan interactions before they left for the World Cup because they were quarantined in Belgium and could not leave that area. And so when they came to Houston, there was a lot of concern in our region about introduction of Ebola. And that took a lot of public health messaging, both from our public health advisors as well as a lot of the academic institutions in our region to say, the precautions have been dealt with, the risk is so low. And so there's a lot of science communication that happens with these events as well, of talking with individuals within the communities. And because this gets so hyped up, the Ebola concern of bringing in with the World Cup was such a high concern in our Houston region that really didn't need that much emphasis, to be honest, and really plays into stigmatization. And again, just these footballers could not have a lot of their fans there. Their families had difficulties getting in. And so it really has been a challenge for them. And we've seen, as you mentioned, with getting visas from other countries to come to the U.S., I know to Canada and to Mexico as well. And it just seems there are very different entrance requirements depending on where you're coming from, which can be frustrating. And again, plays into that, if you can, the preparation piece prior to these mass gathering events. But I know it's been very frustrating for a lot of different countries and a lot of different fans.
2012, Ugandans weren't allowed to travel to the Hajj, for example, because there was a Ebola outbreak during that year. In fact, that particular epidemic had a fatality rate of about, I think, 60 to 70%. So clearly there was a public health interest in not allowing them to travel. Similarly, in 2013, I think, or 2014, with the outbreak in West Africa, certain countries weren't allowed to go to the Saudi Arabian Hajj pilgrimage as well.
Yeah, so it's a good point for a lot of people traveling that, the time required to get these visas and the cost required, it's something they really need to prepare for many months beforehand. I mean, we saw this with Vashina and his mother not being able to come to the first game because it was like $15,000 for a visa requirement. And even in Canada, Jill, you make a good point. There's been several countries that have had a higher visa refusal rate compared to some of the other country acceptance rates. And that's actually been looked at as well. Like, for example, we had the King of Ghana here, King Tutu from Kumasi. And so there was a huge Ghanaian following that wanted to come with him. And there were a lot of visa refusals or delays in regards to that. So it's something that travelers need to be aware of and prepare for in regards to even the border requirements and not just the infectious risks associated with it.
So if we can switch gears for a second and maybe talk about the heat. So, across the world right now, we're seeing record temperatures and, across Europe, there's horrendous things going on because nobody has air conditioning or has any relief. I know people who go to Saudi are used to the heat, maybe, but still there's concern with respect to heat-related illness. So maybe we can talk about the environmental risk for people as they go to these mass gatherings where they may be packed together, where it's, 30, 35, 40 degrees Celsius. No idea what that is Fahrenheit. I apologize, Jill. But where it's high temperatures and what people can do to prepare for that and to mitigate or decrease risks.
Yeah, just out of interest, you mentioned about the flooding and so forth, but there's more deaths due to heat and than any other environmental causes in the United States. So if you look at flooding, for example, if you combine that with with any other environmental disaster, heat-related deaths exceeds all of them combined. So it is becoming more and more frequent, and we know the reason for that. I mean, there's global warming, firstly, and 2024 was the hottest year on record. I think so far Europe has already recorded the highest temperatures in certain cities already. So it's probably going to get worse as we get into the heart of summer. So yes, environmental issues are a definite concern, and especially the heat is a major factor that has to be considered. And I think there's been a lot of education going around, whether it's social media, FIFA's bulletins themselves, educating people about the risk of heat, the types of heat injuries that can be sustained, and also what can be done to prevent it. It's the old adages of making sure that you take enough time to get to the stadiums, for example, stay well hydrated, put on a cap, walk along the shaded areas. And I think most of the fan routes actually have decent facilities in place. The stadia themselves also have all the facilities required. They've got clinics, they've got well signposted places to go to in case there are any issues as far as that's concerned. But we also have to take the factor of fan behavior into account. And here I want to go back to the tragedy in 2024 in Saudi Arabia, where there was an unprecedented heat wave and over 1,300 pilgrims died during the Hajj itself. But if we analyze those factors, and remember Saudi Arabia for the Hajj has probably the best facilities in place. They've got sprinkled walkways, there's water stations along the way, there's medical facilities throughout. They've got at least 20,000 medical personnel stationed for the Hajj period itself. But if you look at the 1,300 pilgrims who passed away during that particular heat wave and that tragedy, 84% of them were what's called unregistered pilgrims. In other words, they didn't have permits to perform the pilgrimage, so they didn't use or they couldn't use the facilities that were there for the normal pilgrim. Some of them were dumped in the desert, for example. They had to make their way out of there to the pilgrimage sites. Some of them got lost, and they were also scared to use the facilities. And we have to give the Saudi authorities credit here. Anyone, whether they had a legal document or not, who suffered from heat stroke, they were attended to. I mean, there was no distinction made between legal pilgrims or not. But the reality of heat stroke, and this was borne out by another tragedy, also during the Hajj in 1985, where there were 2,000 cases of heat stroke. 50% of those succumbed to heat stroke itself during that particular year. So it's one of the issues that is really being looked at during the current World Cup, and really the social media messages going out, the preparations for it is absolutely top class at the moment, but we don't know how fans are going to react when there are warnings given out to not walk midday when the temperature is 40 degrees, to use umbrellas or shade or seek shaded areas. It's going to be how well the message is received by the spectators especially.
Yeah, I think they've instituted things like hydration breaks during the games, which, bring those of us with kids who played soccer back to the early days of parenthood, right? But it makes a big difference, and it shows it shows the fans as well that I think that they should be watching out. Jill, did you want to say something?
Yeah, I do. I want to just expand a little bit on what Salim is talking about, because I completely agree. Based on my experiences with this particular World Cup, I have experience in Monterrey in Mexico, as well as games in Houston. In Monterrey, the game was played in the evening time. It was delightful. The weather was perfect, except for to get there that evening, we walked about 10 miles. We were staying about a half a mile away, but to get into the stadium, you had to walk several miles away from the stadium and then walk back in because of, security reasons. And it was what they had to do to manage the crowds. And so to get into the stadium, you leave at 3:00. Well, it's blazing hot. Mm-hmm. And then you're standing outside and there's no coverage. And Monterrey Stadium did a wonderful job. They, with the situation, there was Powerade stations and things like that. But when I looked down at my watch at the end of the day, I said, oh my gosh, we were walking for 10 miles just to get in and out of the game. And so it's something that fans need to consider, is that you're going to be out in that heat. it's not just the heat. You're going to be walking a very long way.
Just along that line, Salim or Jill, could you guys speak to maybe some of the symptoms of heat-related illness, of like what people should be looking out for when you're talking about heat-related illnesses? Because it may not be obvious, some of the symptoms, and what are the specific things that they can do in regards to when they feel that they're getting those symptoms?
Salim, would you like to start? Oh, yeah, sure. I'm happy to start. So I think, once you get to a point where you are having symptoms is part of the problem. So once you have symptoms, you are already past a point where you are already dehydrated. You're not in the process of becoming dehydrated. And so that's one piece where you really need to be ahead of the game by continuing to drink to prevent a lot of that excessive sweating, to prevent you from even getting to symptoms. Once you get to that point of symptoms, the symptoms can actually be very vague. I mean, we typically think of things like extreme thirst or dizziness, headache, nausea, vomiting, muscle cramps are some of the more common, just that kind of weakness, fatigue, and headache. But it really can be a constellation of different symptoms. And so it really needs to be something that you're aware of. If you're just not feeling right, think about your hydration status and if you really had been keeping up with the amount of water loss that you've been putting out in that day. So typically what I'm looking for is dizziness, lightheadedness, fatigue, headache, nausea, and then it's certainly if you're getting to like muscle cramping and things like that is to a point where you're getting into a dangerous level. But Salim, please.
Diarrhea, right? Yeah. So go ahead.
Yes.
Yeah.
That's what I mean. Like it can be very, very vague symptoms too. So if you're not feeling right, that's something you need to consider. But Salim, please go ahead.
Yeah, no, sure. Like Aisha mentioned, diarrhea and vomiting we see quite commonly. It's just factors that you don't often associate with that. But you're absolutely right. I mean, feeling faint, for example, we often see people fainting, but not even because of severe dehydration, from standing for prolonged periods. Mm-hmm. For example, even walking to the stadium, for example, we've seen it in Cape Town when the World Cup was held in 2010. It wasn't even a hot day. It was warm, but not that hot. But because it's standing for a prolonged period in the heat, there's obviously not enough good circulation to the brain, and it's just pure fainting. I mean, so it's heat-related, whether you want to call it syncope or just fainting, and that's easy to manage. You put them down, lift the legs up. If they wake up, you give a bit of fluids to sip on, preferably a sports drink which contains some electrolytes as well and not just water. So that's when the milder form like fainting. Also, often when there's leg cramps because of excessive loss of salt, there seems to be then a knee-jerk reaction to give salt tablets, which is basically overdoing it. So just using basic electrolytes, a sports drink again, just using fizzy drinks interspersed with water should do the trick there as well. But it's more when we get to the more serious side effects of heat-related illnesses. No, for example, heat exhaustion, where they feeling tired, again, like we mentioned, nausea and so forth. These should be taken to some medical facility immediately. And what we always advise is to not leave such a person alone. Mm-hmm. Make sure that they are accompanied at all times. Take them out of any, get them to a shaded area as soon as possible. If they're conscious, obviously, let them sip fluids, coldish ones. If there's damp cloths around, start using that. But again, try to get to a medical facility as soon as possible. And then heat stroke, I mean, that is the one that we really worry about. If there's alteration of consciousness, they're getting confused, slurred speech is often a giveaway. But also the other signs that we've mentioned. And with heat stroke, often there's not sweating, and I think that's important to recognize. It's often a dry but very hot skin. We walked past quite a few people like that in 2024. And like I've mentioned, there were medical facilities around. So the first thing in the case like that, get the person out of the direct heat if there's an ice bath around the pool, or any cool bath, just put them in there. Take away excessive clothing layers. I mean, whenever people go to a mass gathering, whether it's religious or sporting, they tend to dress in layers. So they're supposed to take them off as they get home. They often don't. And this we often see during the Hajj time, where people put on like 3-4 layers of clothing. And it's difficult to get it all off, but it's important to take off as many layers as possible. If there's an ice bath around, use that. Ice packs, if it's available, put it in the areas where the large blood vessels are close to the surface, such as under the axilla, under the armpits, in the groin areas, the neck areas, even on the forehead, because that assists in the loss of energy and heat. And also, if there's a fan around, even just taking a cardboard or any solid piece, just fanning them around to assist with evaporation. That's the best thing that can be done until medical help arrives. That's just very few of the pointers. I'm sure in a formal lecture on the heat-related illness, a lot more will be discussed. But that's just what other fans can do in the meantime until medical help arrives.
Yeah. They were even handing out like cooling towels, like you just wet them up and they stay cold and cool. So they were actually handing them out during the games and at the fan festivals, which I thought was really neat. Yeah.
And what about injuries? So I always worried. I mean, when you describe, Jill, just taking a step back, when you describe your walk to get to the stadium in Mexico City, what do you do if you have a mobility problem? What do you do if you're in a wheelchair? Making things accessible must be very difficult, or if you have a mobility issue, trying to get there. I always think about that in airports where you have to walk the length of the airport and walk back. But this is way more.
Yeah, I agree. And I was thinking about that as we were walking in every location I've been. It's not one location, it's every single location. And I do think it has been considered. I did see areas for individuals who had mobility issues to have earlier access into the stadium instead of going all the way around like the general population. And so I think that's a consideration for each stadium, each event that you're going to. It's going to be a little bit different. And so understanding where you're going and what access they have for what your needs are going to be important. But it's not a one size fits all. And you do really have to be creative to get there and to be able to enjoy these experiences too.
So I work at a sexual health clinic here with Toronto Public Health, and we launched a huge campaign here, and because the World Cup aligned with Pride, and with that many people, the concern was the increased risk of sexually transmitted infections. And you can see here they launched this condom campaign. Block the shots. What a finish! But can you speak to the changes in behavior that come along with these mass gatherings, and the risks associated with maybe having a little bit too much fun?
Sure. So I think, Aisha, you're probably the expert in this area, more so than the rest of us, but it's certainly something that we need to be talking about with not only the fans and the diasporas coming together, but also with the athletes, depending on the housing situations that are available. So not as big of a issue for like the FIFA World Cup for football, but certainly for things like the Olympics, where everybody is housed in one village or one region. And I think for those events, they do efforts to provide education when there are athlete villages. In this particular case for us, especially in Houston, where we're seeing this massive increase in sexually transmitted infections, just at baseline pre-mass gatherings. So we had over 100% increase in syphilis in the last few years here in Houston. Certainly have high rates of HIV and other infectious diseases, sexually transmitted infections. And so it is something that we need to consider for the fan bases coming into these regions and having the appropriate resources available, as well as providing those fan bases clinics that they can go to get the help and support that they need. And that's not, again, a universal procedure. We do not have that infrastructure that you have and that your public health campaigns are doing in Toronto. It is not the same in Houston. It is not the same in other host cities right now. And so it'll be interesting to see what types of changes that we see in the next couple of weeks to months post this gathering.
Yeah, no, it's interesting because we are doing some public health tracking here where when people come back positive, there's a survey that goes associated with it and it asks them what locations they were attending, like what fan fest and which games. But go ahead, Salim. And also, I'm curious about Mpox, like that, especially kind of with what's going on with Pride. I'm wondering if you guys could speak to that as well.
Hey, let's just marry casual sex with the FIFA World Cup. If you look at 2014, for example, which was held in Brazil, there were more incidents recorded of STIs amongst the football fans than normally that's documented amongst tourists. So there was an uptick of it during the FIFA World Cup. Now we know in travel medicine generally, we're looking at between 20 to up to 34% of travelers having casual sex with a new partner whilst they're traveling. So it's well documented. I mean, Geocentral has given out good statistics on that. Condom use, depending on which study you look at, is between 25 to 75%. It's probably lower, but these are the statistics that's out. So it's clearly very, very prevalent that casual sex and predictable that it's going to take place. And like Aisha's mentioned, is the public awareness programs going about. But as I mentioned previously with my heat-related interruptions, human behavior is difficult to predict. And it's again going to be messaging, sending out messages about safe sex, how to prevent STI, the dangers of STIs. But whether someone's going to adhere to that advice after the team has just won and going through to, for example, the semi-finals whilst they're celebrating, it's difficult to enforce those type of advice, and it's actually difficult to foresee it actually being followed as well. As far as Mpox is concerned, I mean, we know there's been well-documented cases and the spread of it, for example, during the Pride Festival on the Canary Islands, mostly men having sex with men. Lots of documentation of that, as well as, and I can't remember the other event the Darkland event I think it was in the Netherlands, also well documented, spread amongst the participants there. So advice, again, and it's not counseling, sending out a message about safe sex and prevention being better than cure.
Just to refocus perhaps a little bit, well, not refocus. I mean, everything we've been talking about is important, but we were talking about things that sting and bite. And that just reminds me that there's also non-vaccine preventable vector-borne diseases, which are quite important in a number of the countries that the current games are taking, the football is taking place in. Jill, do you maybe want to remark on things south of the border that sting and bite?
Yeah, that was Albie's segue from sex. Is things that sting and bite. Just say.
And south of the border, I got it.
South of the border. Go on.
I'm Albie. We're right here. I got you. We're right on the same wavelength. I think bite stings dermatologic issues, those are a huge concern too. And, there are vaccines for dengue in certain regions. There are vaccines for chikungunya in certain situations. But those aren't readily available, especially here in the United States. We don't have a dengue vaccine. Chikungunya is not readily available unless under certain conditions. We do have issues still with rabies, for example. So not just mosquitoes and ticks and things, but we're thinking about animal bites as well. And so these are big issues that we don't have a lot of access to. So avoidance of vectors, whether they are insects or animals that could be transmitting diseases, is another important consideration. So in the southern United States, we certainly have Aedes mosquitoes. We have had outbreaks of dengue, particularly in South Florida, but also in Texas. Pockets again within Mexico, although not in larger areas like Mexico City. We have not had recent introduction of or outbreaks of Zika or Push, but we have had malaria too. So in 2023, we had outbreaks of malaria, locally acquired malaria in Florida and in Texas. And so vectors are an issue, especially when you have persons entering into a formerly endemic region from an endemic area where the vectors are still present. The risk of introducing those infectious diseases is there. And that's something, especially along the Gulf Coast, that we have done a lot of surveillance on, because that is something that we have a very high concern about, is introduction of more dengue, of Zika, of chikungunya, and of malaria into our region. And so surveillance, epidemiology, is going to be critical in the next couple of weeks to months as our mosquito populations continue to flourish in the South, where we're seeing, nearly year-round presence of mosquitoes. And so certainly from mosquito-borne illnesses, surveillance is critical. Mosquito avoidance is important for our visitors and for our local populations. And then in terms of other bites, avoidance of animals, stray animals. We definitely have a huge stray animal population issue in Houston. And so something to consider for our travelers into both Mexico and southern United States. In terms of other areas in the U.S. and certainly Canada, and Aisha, you can speak to this too, there are other vector-borne illnesses. We have West Nile going on right now here in the U.S., and different viral encephalopathies that are transmitted through vectors as well. So summertime in the U.S. And I'm sure in Canada as well, there are outbreaks of these vector-borne diseases, and people need to be aware of that as well.
You haven't mentioned ticks, but I think the first time I went to the ISTM conference was in New York, and it must have been in about 2000. And we had an excursion with the ISTM Exco to Long Island. And for the first time in my life, I saw a place where the ticks are so dangerous that they had a chicken wire fence up that said, "Beware of the ticks." And I was totally fascinated with Africa, because we don't put our ticks behind fences. They're not that bad. But your ticks transmit Lyme disease.
Yes,
and
absolutely.
there's been a lot of ticks this year. Ticks. We've had a huge explosion, even within the city of Toronto. We've had people coming in with a lot of ticks.
And I think that's important for travel health practitioners and travelers who come from other places in the world to just be aware of that, so that if they get sick with, a strange disease with a rash and a bite and a this and a that, that one, they give a travel history to their medical practitioner, and two, that there's an awareness that it's not squeaky clean. America is not as squeaky clean as Australia used to be. Sarah isn't here, so we can flake this Australians just a little bit. But, there are vector-borne diseases in the Northern Hemisphere. We're talking about Portugal and Spain for the next round of soccer. And ticks are a major issue out there as well. And so are some of these mosquito-borne diseases sort of making an appearance.
Yeah, and it's not just ticks. So at least here in the U.S. and the southern U.S., fleas are an issue too. So murine typhus, for example, we call summertime doxy deficiency time, so season, because there's so much murine typhus that we see here in the Gulf Coast area, and so any fever, rash needs to be evaluated, because these are illnesses that have an intervention that could help the patient feel better too.
And to our non-medical listeners out there, we talk about doxy deficiency. So doxycycline is the antibiotic that we use to treat many of the tick-related diseases that are transmitted. And so we like to say that if you've been bit by a tick, you might have vitamin D or doxycycline deficiency. All right, guys. So I think we are hitting our final time, but we're going to add on some minutes and maybe go into a penalty shootout here. Okay, so let's do this penalty shootout lightning round. All right, we're going to go around and maybe ask 3 of the most important tips for travelers heading to a mass gathering, such as the World Cup or the Hajj or other mass gatherings. So who should we start with? The GOAT? Should we start with Albie? Are you the GOAT?
Yeah.
We saw Ronaldo's penalty kick yesterday and my life is complete. So in person. So good. So good.
So are you picking on me?
Okay, fine.
Yes.
Okay, fine. Let's go. Okay, Jill. Let's go, Jill.
I'm the
Jill.
presenter. Our guests are supposed to make their screen
Okay.
But I don't
So
mind. I don't mind being picked on. So what I heard in this again is how interesting travel medicine is, why we can all be excited about it, because there's this huge interplay in what we're talking about now between personal health interest and public health interest, personal protection and public health protection, and how all of this comes together, and the one can't stand apart from the other one. So the idea may be that travel medicine is a luxury for rich travelers going to exotic places, and they need special vaccines, goes out the door, because it all starts with you've got to be up to date with your childhood vaccines, your adolescent vaccines. If you've got that, you've got a very good start already, and then you can start thinking about more exotic diseases that may or may not be vaccine preventable, education, understanding what your risks are going to places, whether it's heat, excessive exercise that you may not be used to, or sexually transmitted diseases. They all should be remembered whether you're going to travel individually or whether you're going to a mass gathering. Now, maybe Salim would like to give us his 3 takeaway points.
I've been traveling with pilgrims to the Saudi Arabian Hajj on an annual basis for the last 22 years. I've walked with them, sometimes up to 25 kilometers on the most auspicious days. I've learned what drives them. I've learned what actually motivated them, understood their reasons for going, even though some of them really shouldn't even have been boarding a flight in the first place. But really the essence of the reasons for travel varied from deeply spiritual, deeply redemptive for whatever reason, and also to accompany other people and experience the fact that they are walking and intermingling as equals with about 1.5 to 2 million other pilgrims at the same time, at the same place, and for the same common purpose. And that deeply affected my understanding of travelers in general as well, not only to religious pilgrimages. People have said, for example, 2 of my patients who are traveling to the United States have said for more than 10 years for this particular event. I understand why they're going. They're deeply heartbroken now, obviously, that South Africa is kicked out of the tournament. But the reality is that it's a life-changing experience for them. And this is what travel is all about. I mean, it is not just the moving from the source to the destination and back. It is a lived experience all along the way. So from that perspective, when I talk to travelers, intending travelers, these are the 3 top considerations that I always consider. The first thing is, why are they traveling? Who is traveling? What the purpose of the journey is? Secondly, what are the risks on that side? And a lot of them, like for the Hajj, for example, Meningococcal disease is vaccine preventable, and vaccines, again, is quite important. And thirdly, that they know the risk at that particular event that they're going to, and that they take adequate and timely precautions against it. Whether it's heat related, whether it's any other one, but they must know what they're going for, what to do about it, and then when to seek medical help when they're on that trip.
Thank you, Salim.
Michael.
Jill?
All right. So my top tips come from the perspective of being an infectious disease physician, but also being involved as an infectious disease consultant with U.S. Soccer. And so what we want is for people to be prepared, whether they are athletes or whether they are travelers, to enjoy these mass gathering events. So my top takeaways are, number one, preparation and education. Preparing yourself, knowing where you're going, knowing what your risks are is the key to having a successful trip and an enjoyable experience. So having that information is really going to arm you for success. My second tip is vaccinate, vaccinate, vaccinate. And in reality, it really should be my number 1, 2, and 3 recommendation. Even just your routine vaccinations are critical to prevent illness and to make sure your experience is enjoyable and illness-free. So getting your vaccines, including measles, pertussis, tetanus, the routine vaccines for childhood, and being up to date as an adult are critical. And then thirdly, and I think most importantly, is go on the trip, enjoy yourself. It brings so much joy. If I've learned anything from the past couple of weeks here in traveling to different regions of North America, is how much joy this mass gathering has brought, how much it has brought people together, how much we've learned about different cultures. It is so important for the world that we're experiencing each other and experiencing how others live. And I just really, if you're prepared and you're vaccinated, you know, these are incredible life experiences that I highly, highly recommend everybody take part in if they're able to.
So
Right.
true, Jill.
Thank
I
you
think
very
it's been amazing to see these diasporas coming together from around the world. Like I've watched the World Cup before, but this is the first time experiencing it and just seeing so many cultures and people coming together, celebrating each other, being joyous together, celebrating health and sport and vitality. And we're talking about like millions of people across the entire world. And I think that is really special. And that is something that, as Salim mentioned, we shouldn't forget the reason why people go to these mass gatherings. What is the purpose? What is the humanity and that thread behind it? And I think it really, that is the essence of what makes these mass gatherings so important for people. And I think it's important for people are prepared so that they can have the maximum amount of magic and joy and whatever their goal is to get out of these events that they're going to. So the 2026 FIFA World Cup, I think, will bring unforgettable goals, moments of magic, and millions of fans together across borders. But as we've explored, behind every great mass gathering and tournament is another kind of teamwork. The travel health, the public health teams, the surveillance systems working in the background to keep everyone safe and keeping everybody in the game. And because in mass gatherings, the risks don't always wear jerseys. Sometimes they arrive as viruses, heat waves, injuries, or outbreaks. And in travel medicine, our job is to stay one step ahead, to anticipate the next play before it happens. So whether you're traveling to cheer from the stands, joining the crowds in the fan zones, or watching from afar after your team's been kicked out, remember, preparation is your best defense. Prevention is the ultimate goal, and good health is always a win. So if you enjoyed this episode, share it with your fellow travelers, sports fans, pilgrimage seekers, and don't forget to subscribe so you never miss an update. You'll find the links and resources from today's discussion in the podcast description. And from the Travel Unraveled team, travel, stay match fit, and always keep your health on side. And that's the final whistle.
So that's a wrap for this episode. Don't forget to follow Travel Unraveled on Spotify and on Apple Podcasts or on your favorite podcast platform. We'll post fun clips and extra resources on the ISTM website located at learning.istm.org/podcast. We're also on Facebook, LinkedIn, X, and Instagram at _ISTM_. Finally, and thankfully, Travel Unraveled is produced by Ghost Bureau out of Toronto at ghostbureau.com.
Please remember that the information presented in this podcast is intended for educational and informational purposes only. It should not be considered medical advice, nor is it intended to replace consultation with a qualified healthcare professional. The views expressed by the host and guests of this podcast are their own and do not necessarily reflect the opinions or policies of the ISTM or any medical or other health professionals, hospitals, clinics, or healthcare facilities. While we strive to provide accurate and up-to-date information, the medical field is constantly evolving, and there may be new findings or developments not included in our content. We encourage our listeners to consult with their healthcare providers for any medical concerns or before starting any new treatment. Neither the ISTM nor any of its affiliates, sponsors, producers, hosts, or guests are liable for any direct, incidental, consequential, indirect, or punitive damages arising out of access to, use of, or inability to use the content of this podcast, or any errors or omissions in the content hereof. By listening to this podcast, you agree not to use this information as a substitute for, nor does it replace professional, medical advice, diagnosis, or treatment. Always consult with your healthcare providers for guidance appropriate to your specific health situation. Thank you for listening to Travel Unraveled. We are committed to sharing knowledge and fostering discussion in the pursuit of better health and well-being.